Number 9, treat the exam like a regular clinic. If you can, try to treat it like a regular clinic, just with a few modifications, i.e. it's done remotely, whereas in real life now most of us aren't seeing a lot of patients remotely, although you'll do some telephone consults. With the benefit that you get a break halfway, you don't have to physically examine anyone, and you're not having to write up lots of notes. Don't make up options that wouldn't be sensible in real life because you're trying to tick an imaginary box of involving the patient in decision making. If you would do something in real life because it's sensible, do it in the exam. Don't do any acting. Let the simulator do the acting. Let me give you some examples of what would be appropriate, what would not be appropriate. Let's say you've got a patient who's got what fits with gastroesophageal reflux disease. They've got no red flags, no indications for an endoscopy. It would be perfectly sensible in real life and therefore in the exam to say to them that, look, there's a couple of ways that we could approach this. One is we could test you for a stomach bug that can cause extra acid, and if it's there, there's a treatment that can help to deal with that. Another option is we could just give you something to reduce the amount of acid that your body's producing, and for a lot of patients that helps take away the sort of burning pains that you've been having. Do you have a preference? And the reason that's a sensible option is the guidance suggests that one of those is not better than the other. What would not be an appropriate option is to say to the patient, let's say a patient chooses that they just want to have a PPI. It wouldn't be sensible to say, do you prefer omeprazole or lansoprazole or pantoprazole? That's not a sensible choice to give to a patient in real life. That's not something that you're going to do in the exam. Equally, don't make up a choice for the sake of having choice, especially if that choice would be unsafe. So you've got a patient with what looks like an acute coronary syndrome. We need to get them into hospital via ambulance as soon as possible. There aren't multiple choices there. It wouldn't be sensible to say that's one option. The other option is we could leave it to see how you feel by the morning. The patient may well be dead by the morning with that intervention. That would actually be really, really unsafe, even negligent. Okay? And so you wouldn't do that in real life. Don't do that in the exam. Instead, you let them play the role. You just try to treat it like a real patient, give them the full attention and care that you would, show the knowledge that you already have. You're doing this every day. You're seeing patients every day. Okay? If you can try to treat it like a clinic, it'll help you to be a bit more natural. Hopefully you forget that you're in an exam situation and you can show all of the skills and the knowledge that you have and come across as a caring, knowledgeable, competent GP. And that's exactly what the examiner is looking for and what's going to help you to get a great score.